stop. We're small and it's an intimate group today. So
I really can only stay for about 35 minutes, but I thought I'd pop in and see what's happening.
Yeah, that'd be great. So I think really today is a bit of a reflection on some of the previous sessions to date, and in particular trying to give a bit more space to have some unstructured conversation and discussion about what's going on and how it has affected folks' experiences in terms of perhaps some of the impact bonds and public contracts that they work on, what their experience has been at work generally if they aren't working at impact bonds, and then really think through kind of, you know, March until now, what has facilitated or really been quite challenging, facilitated success or been quite challenging, and then also perhaps sharing a bit more about kind of what you think the next 12 months are going to look like in terms of your own work. So I thought maybe, given that we are small, if we could just do a round of introductions. And so perhaps what we can do is I'll start, maybe we'll go Ian, Edward, and then Lee. And instructions for sort of what would be helpful to include in your introduction are in the agenda. But effectively, I think if you could kind of just give us a sense of who you are, what you do, what your organization is, and kind of your interest around ERGO, and then perhaps what you do in your job. So over to you if you want to kick us off, Ian.
I love the signs of misspent youth with all these guitars floating around. I've got a couple behind me as well, a bit out of sight. I work for an organisation called the Growth Partnership. We set that up in Scotland recently, a couple of years ago, to develop and promote the use of social impact investment, having been involved in establishing the only social impact bond to have been done in Scotland. Doing that social impact bond convinced me of two things. It convinced me there's enormous potential moving money around the system in this way, and it convinced me, man, there must be a simpler way to do it. And so we developed and you're nodding, Neil. We developed a simpler legal financial structure to do that, and we're trying to get that moving in Scotland. Scottish government and statutory agencies north of the border are slower to pick that up. We haven't got them to take one on as yet. We have a number quite close, but none of them actually committed. And I guess COVID might focus their minds more. It might have the reverse effect. We're just kind of waiting to see on that. But that gives you a little bit of context.
Thanks, Ian. Over to you, Edward.
Hello, everybody. Edward is Hickman from ATQ, colleague of Neil's. We, as an outfit, have been either helping commissioners with the process of working up what a social outcomes contract might look like for them, and or working with provider organisations, working out how they might try and deliver against some of those requirements and pitch and bid them. That's one angle. We also are working alongside Icarus on the evaluation of the CBO fund, which gets us quite a good look at various of the projects that are out there, that particularly those obviously in the early part of the funding arrangements. So we've got quite a sort of lengthy, so we go back to 2012, really, 2011 even, was when we first did something for the Cabinet Office around this use of outcomes payment models. So I think that probably summarizes it. But the interest in ERGO is obviously it probably comes as much from the evaluation and what people are finding, because it will impact on how we put some of those findings out there. I'm sure the impact that it's had over the last 3 months and how it will play out in the future. And I think the point Ian's just made about the complexity is something that Neil and I chunter about quite a lot in our spare time. So we'll come on to that, I'm sure.
Great. If I could go to Lee and then maybe Graham and then to Juliana.
Hi there, everyone. So my name's Lee, and for those that don't already know me, I work within the Go Lab. And I guess for you guys, what the takeaway thing is that I work on is I perform a coordinating role across our peer learning groups, whether it's ERGO or some of the regional ones and the other ones. So the idea is take a temperature gauge, if you will, of what's happening in your day-to-day lives and how we can feed this back into future sessions. And you will obviously see me popping up on emails, constantly asking for your feedback and comments, so we can make these more engaging and tailored to what you're experiencing on your day-to-day life. So again, gentle reminder, if you will, that we always, or I'm very much looking forward and wanting your feedback and comments so we can incorporate this into future sessions and potentially other peer learning groups as well.
Thanks, Lee. Over to you, Graham. Oh, you're on mute.
Hi, I'm Graham Phillips. I work for Norfolk County Council. I was a fellow at GoLab last year, and I work on external funding. And with the support of GoLab, Lee and Andrea in particular, we set up the East of England Regional Peer-to-Peer Group. I think at the time it was the first one that had been set up. So a fair piece of my work is expanding that. So we now have 2 housing associations who are involved in the Community Impact Investment Fund on board regionally. We have, I think we've got a total membership of about 15 now. We're looking forward to reintroducing that once everything settles back down. And unlike a lot of others, we're actually very much a practitioner-based peer-to-peer group. So it is, what we're trying to do is create a regional landscape that is social investor friendly. That's really what we're trying to do. Alongside that, then there are steps we have to take, which are building the capacity of our VCSE sector in particular to understand, gain expertise, and have the capacity to take on board social investment and outcomes focused contracts. So I do a fair bit of work on that, and then trying to make that part of a standard blended model of funding in which we mix grant funding, our own commission funding, our own delegated grant funding, and social investment funding in a bespoke package that we can offer to regional organizations.
Thanks for that, Graham. I'll pass it over to Juliana, and then I'll come to you, Faye, and then to you, Jennifer.
Great. Well, hi, everybody. My name is Juliana. I am working as an intern here at the GoLab, and I am particularly focused in the Indigo network, which is a network about data on outcomes that I'm sure you will hear very soon about it. And what this session is about impact and impact evaluation, and I'm sure that COVID is going to have some impacts on your data collection processes and all your data related work. So I am really interested to hear about that. And that will be me. Thank you.
Thanks, Juliana. To you, Faye.
Sorry, just having a little technical issue there. So I'm Faye Campbell. I work for Sheffield Futures, which is a young people's charity in Sheffield. I'm currently working on Project Apollo, which is a SIB-funded model. It's the second SIB-funded model programme I've worked on. And we were about halfway through the programme when coronavirus and the lockdown hit. So I'm very interested to know what other people are doing around delivery and what they see the challenges are in this time. It's been quite an anxious time, both for clients and staff, to understand how this is going to impact on the programme.
Thanks for that. Jennifer, I'll come to you, and then Elle, and then to Steve.
Hi, everyone. My name is Jennifer Lee Jones, and I'm based out of the Toronto area, the GTA, Greater Toronto area. I have about a 30-year experience in communications in nonprofit and wellness for the most part. And I have recently pivoted to peer support. So I'm immersed heavily into my learning curve right now. And one of the reasons I'm attending today is because I was very interested in the topic, in the context, and one of my ideas here is peer support is starting to get a foothold here. And I've noticed more and more organizations such as hospitals are beginning to apply it. So one of my interests is the area of cancer in peer support. So I'm looking to cobble together a wee bit of a pitch. So I'm very interested in outcomes.
Thanks for that, Jennifer. Yeah, to you, Elle.
Hi, everyone. I'm Elle Carter. I'm the research director at the Go Lab, and I listen into these calls, and it feels a bit rude to not show my face. But as a team, we're really focused on trying to grow our understanding of outcomes-based approaches to complex public service delivery. And so, just really keen to hear more and understand how people are adapting, and reflections on how we can best evaluate and research in this space.
Thanks for that, Steve. And then I think if I hit Ruairi next and then Neil, and then Lorna, we've gotten to everybody. Is that true? Okay. Steve. Oh, I think you're still muted.
Is this me, Ruairi?
I was going to Steve, but I can't.
Okay, sorry.
Sorry.
There you are.
Yeah. I'm Steve. I'm the SIB project manager for the Elton John AIDS Foundation Zero HIV project, and that's looking to use a SIB approach to drive integration across health sectors in South East London in order to promote early diagnosis of people living with HIV, and also re-engagement of people who have dropped out of the system for 12 months or more. So I'm interested in thinking more about how the SIB has been a vehicle for doing this. There are other ways that we could have funded it. I'm interested also in thinking about how we might be able to use this knowledge within other applications for health, such as other long-term conditions, chronic conditions. And I've really enjoyed being part of this community. And I'm not clear whether my organisation will use another SIB approach. If it does, then potentially maybe in the UK or maybe elsewhere. So it's been really useful for me to just hear about other people's experiences, both within the UK setting and in other countries. And it would be great if we had more health-related SIBs within our community, because it feels to me that it's quite a lot of focus around education and social care and employment. So I kind of feel the need to wave the health banner within the community.
Thanks for that, Steve. I think I said Ruairi and then Neil and then Lorna.
Hi, my name is Ruairi. I am originally from Belfast, Northern Ireland. I have been in the United States for almost 20 years, working in different US federal agencies, managing different projects. And I am a lawyer, now based in New York. I do not practice law. I am a research associate at the Go Lab. I'm very much interested in public procurement and contract management. And I coordinate another peer learning group called the POGO Club, which is the Procurement of Government Outcomes Club. And we were looking at sort of emergency responses and how helpful the contracts were. And it was very striking to everybody that the contracts weren't very helpful. And that this, the emergency response required something more like a relational response than sort of going to the contract and the contract helping. And it sort of has exposed that, a lot of the legal forms that we have for these mechanisms don't really describe well the governance mechanisms that are actually used, or the just management practices, or the just getting on the phone and talking to people and sort of calibrating and figuring it out. And so that's interesting. We're sort of thinking about what to, how to respond or improve or what to do about that. And another initiative I'm leading on under Elle's direction is Indigo, which is our international network for data on impact and government outcomes. This is sort of launching, As Juliana mentioned, she's an intern focused on Indigo. This is about sort of data collection and collaboration and data use around sort of these projects, these arrangements. And we, I think, would have launched earlier had it not been for COVID-19. It seems a bit weird to sort of go out to projects and ask them to describe, give us data on their projects as it existed before COVID-19. COVID-19 is impacting all of these projects. So I think it's important for us to be thoughtful and humble and respectful about what's happening on projects before sort of asking for more data, and thinking about how the data that we ask for, does it describe the world pre-COVID-19, the actual change process, and then sort of what things may look like going forward. Anyway, that's what's going on.
Thanks for that, Rory. Neil.
Hi everyone, I'm Neil Stanworth. As Edward's gone first, he's the director of ATQ, I'm another director of ATQ. So we do very similar things. You've got most of ATQ on this call. Slight bit to add, I too was a fellow of GoLab for 2 years, so I know a lot of the folks on this call. If I didn't know them before, I knew them in other ways. I've worked with Graham, recently connected with Steve because I'm involved in evaluating the EJAV SIB for the CBO. Just the two other things to add. We've done quite a lot of research beyond the CBO evaluation, including some sort of quicker research for DCMS on barriers to impact bonds and outcomes contracts and growing them, which was published last year. And on the ERGO group specifically, I'm quite interested in what comes next and how we can learn from what we've done. One of Steve's phrases I've heard on this call is never waste a good crisis, and I think there's quite a lot to be said for that. There's a lot we can learn, I think, about how you can blend different ways of interacting with people and how you respond to things that really knock projects sideways and can or can't get them on track. So it's been very interesting joining these discussions.
Thanks for that. And Lorna.
Hi, I'm Lorna Cottingham. I work at Norfolk County Council with Graham. We both work in the external funding team. He is very much the SIB guru, but he invited me along this afternoon to meet you all and to kind of see what what you're about. And one of the roles that one of my main roles is influencing and trying to network people within the organisation at the council, but also with external partners to try and obviously attract external funding from a variety of sources. But SIBs certainly is something that the County Council is obviously very interested in, and Graham is most definitely an expert in. So I'm just here to be a voyeur, really, but it's lovely to meet you all.
Nice to meet you too, Lorna. We welcome voyeurs. So I suppose I'm also a bad host because I didn't introduce myself, but my name is Clare FitzGerald and I'm a research fellow at the Government Outcomes Lab. Having heard everybody talk through sort of their various roles, it strikes me that perhaps we might structure some of this conversation of stock taking from perhaps March until now, maybe around 3 different kind of streams. One is maybe sort of the facilitators to success and perhaps barriers to success related to ongoing public service delivery, be that sort of staffing, social distancing issues, or indeed ensuring funding streams. There's also probably a batch of facilitators to success and barriers to success related to evaluation challenges, and we can talk about some of those. And then I think it seems like there's some desire to have a conversation around what the future holds, in particular in thinking about outcomes-based approaches. So I think maybe with that kind of schema for what this conversation might be, and given that, Graham, I know you have to head out, I'm curious if maybe you could kick us off with a bit of a stock take. So from March until now, you've been, you work quite a lot on the funding side of things, and I'm curious to know what has been quite challenging in terms of securing some of that funding moving forward, or perhaps any aspects to the impact bond projects that are live or future, what about them might still be compelling to funders?
Yeah, well, that last question is really interesting. I'll start with the easy one, which is that our voluntary community and social enterprise sector, have I frozen just by the way, because everyone else has on my screen?
You are not frozen to me.
Okay, good. So we're expecting a mortality rate among our voluntary and community sector and social enterprise sector of around 20% across the board. That's after chatting with our infrastructure organization. That in itself is quite a challenge as we move forward for social investment funding. Some of the organizations, and these are not just small organizations, we've got one of our largest key delivery partners has just furloughed all of its staff, and including its funding director and its project directors. And they don't know if they can bring them back. The real issue is not now. The real issue is what happens for our delivery partners that when the furlough scheme ends or when they have to start paying for it. And nobody knows the answer to that, I think, is the question. That is a big barrier because our delivery partners in social investment projects in general, or funded projects in general, do not know how they are going to exist once that furlough scheme ends. And that's been iterated to us many, many times by lots of organizations. So in terms of current social impact bonds, we've got 2 in delivery currently and a third, a carers one that is about to go into delivery. That is going to be the most impacted because it hasn't yet started delivery. And we don't know what's happening with our delivery partners, and they don't know. And that's the big barrier, I think. I think the interesting thing about Steve, who was saying, I'd like to see some health-based projects, is we cannot find a rationale for making payments against health-based SIBs. We'd love to do some. With Neil, we looked at doing some. But for a local authority, as the commissioner, it's really difficult to see where those health savings are. And I think that one of the big impacts out of COVID-19 is going to be in the social care and health sectors, about where will those savings exist if we are having to spend so much funding on just keeping our delivery partners alive. So that's, I think, a key barrier for us.
Thanks for that. Neil, I see a hand up.
Just quickly, I wanted to comment when I was introducing myself that it's clear that having worked on 30 SIBs or so far, plus the evaluations, the reason we haven't got more health SIBs is it's so darn hard to get anyone in the health sector to pay for outcomes unless they're getting an almost immediate payback. And as Graham said, we jumped through quite a few hoops to try and get CCGs engaged in Norfolk, and we had some pretty good evidence, but it wasn't good enough. So that's a common issue. And also, they're just not very good at commissioning. And to say something very controversial, since we're not allowed to say anything critical of the NHS at the moment, they haven't shown themselves to be great at commissioning through COVID-19, frankly. It's all someone else's problem.
No,
exactly.
Steve, I see your hand up, and I know you're working on a health SIB. So do you want to, go for it.
Yeah, and it's interesting because as Neil and I were speaking the other day in a separate conversation, our SIB is somewhat different in that, coming from a voluntary background, we actually have the ability to backfill some of the funding that the local authority commissioners are paying out. So there is a kind of a cyclical thing that we're benefiting from payments from the commissioner, but actually we're also backfilling some of that payment ourselves. And I think one of two of the issues around are about this is an interesting way to be able to develop best practice around integrating across local authority, voluntary sector, primary care and acute care. So that's one interesting thing about it. And the other interesting thing about HIV is that if people are on treatment with HIV, then they're not actually infectious to other people. So there's kind of like a saving for the health service in terms of early diagnosis means better outcomes, means less inpatient stay. There's also a saving in terms of earlier treatment and engaging, retaining people in treatment means that there's less HIV infection, therefore less cases. I absolutely agree with Neil, the kind of the cashable savings part of this is always difficult. And I think, you know, my background is mostly within cancer care within the UK and within the voluntary sector. And my experience has been that there are two approaches and they are complementary. One is about commissioning, better commissioning practice based on evidence, but possibly the stronger of the two is about better practice, evidence-based practice being taken up by professionals. And that may or may not be related to commissioning pathways. So getting in through, you know, as example, of NICE guidance is very difficult to influence, and there's only a window every few years. But that kind of thing we're able to do. And Neil's challenge to me the other day was to say, well, okay, yeah, but, you know, did you need a SIB to do this, or, you know, could you have done it through a grant? My personal view, based on 2 months' experience into the organisation, is that the SIB has been helpful because it has brought on commissioners in a way that I think just a grant to the local authority for provision of services type stuff just wouldn't have done. So it'd be interesting to know if that's similar across other sectors, whether you think that, you know, if it wasn't an outcomes-based payment, or rather if it was an outcome-based payment but it was done through a grant basis, would that have made a difference? Or is the fact that the commissioners have seen that this is a SIB, has that kind of switched on some kind of commercial entrepreneurial switch within them, and has that enabled the early adopters within whatever organisation to kind of bring along some of that kind of middle part of the bell curve and actually get them thinking in a different way than they would have done were this just a grant? So I'd be really interested in people's perspectives on that.
Thanks for that, Steve. Yeah, I think this question of has the SIB enabled something that is unique and different from other kinds of commissioning approaches in an emergency context is certainly something that lots of folks are interested in talking through. Rory, I saw your hand up and then I'll come to Edward, but I would also like to maybe bring Faye into this conversation and bring us a provider perspective, especially related perhaps to some of the stresses on provider organizations and delivery entities to be shored up in the short term, and how that might be affecting maybe staff morale and other things in your organization. So Rory, Edward, and then over to you, Faye.
Just very briefly, thanks. Some of the comments remind me that we have a visiting fellow called Ken Moriyama, who in Japan was managing a health-related SIB for, I think, cancer screenings. And the idea was that they would take on more, I guess, social media, electronic, sort of text messaging approach to encouraging cancer screenings. And they were, I think, paid on the basis of sort of increasing the amount of screenings that happen, and that seems to have been successful. But I've just given my entire sort of all I know about this project, and maybe it might be good to connect some folks here with Ken to hear about that, if that's helpful.
Thanks for that, Rory. Edward.
Okay, but very quickly, where we've had some experiences where both health and social care budgets are combined and you either have the health authority doing the commissioning side of it or the local authority, but the budgets have been pulled, and they're generally around long-term conditions like challenging behaviours and so on and so forth. And I did notice, so I think that's one potential route, if you like, for trying to get a combined health and social care set of projects underway. But I did notice the other day in one of the papers that one local authority, I think it was a London one, had suspended its arrangement for that co-commissioning because of the pressures on its funding in general. It just felt it had to separate out again. Now I'm wondering whether that kind of momentum is almost going into reverse with COVID. but I will monitor that. But there are good examples of that kind of joint, or at least pooling of resources around certain client group cohort needs that's been going on for a while.
Thanks for that. Yeah, I think for me too as well is a question mark in terms of, especially if we're trying to design some of these things to be responsive or in the recovery phase, realistically, how quickly can an impact bond be set up to be sort of responsive to an emergent need? So, you know, question marks around whether or not this is the right tool or if it can be scoped accordingly. But Faye, I'd like to come to you. Oh, I think you.
Hi, yeah, I'm with you. I've just got a very tricky laptop. Yeah, so in terms of delivery, so Project Apollo is working with care leavers aged 17 to 25 who are a very difficult group of young people to engage and to keep engaged. And so the first challenge that we faced as a project when this hit is that obviously we're very heavily reliant on face-to-face contact to achieve outcomes. So when face-to-face contact disappeared and we had to do it as remote contact, it presented an immediate challenge, particularly as care leavers often don't have access to any type of IT. Now, Department for Education have responded to that, and there is at the moment, they are rolling out a programme to provide IT to care leavers via local councils, but actually this has been very slow to get off the ground, and as of the end of last week, none of our care leavers had received any equipment. So that's been a massive challenge. The other thing was about the length of our programme, because as I said, we're halfway through, and what you know, the first thing that we thought of is we're going to have a substantial loss of delivery time. So although we can keep, hopefully, our young people engaged by keeping contact, we can't actually do the work we would normally do with them. So we were looking at, you know, potentially a 6 month loss of delivery time, and the impact that is going to have financially and you know, in terms of successes for young people. So we've actually approached DFE to ask the question whether there would be any additional funding for to extend the delivery time by 6 months, and that's something that we're currently pursuing. If that isn't available to us, then we need to look at the viability of the programme and how, you know, that may be funded either by our own organisation or possibly Sheffield City Council. But of course, all of these things take time and, you know, give a great deal of uncertainty for staff, you know, around this. So Department for Education, like many of the government departments who are commissioning these programmes, did act quite swiftly to agree that we would continue to get payments on projected outcomes rather than actual outcomes achieved for 2 quarters, so to give us some stability in terms of cash flow. But we are still awaiting a decision about how they're going to reconcile that at the end. And as I say, if we don't get an extended delivery time, then the reality is that we probably couldn't make up that ground with outcomes. So yeah, that's all, you know, quite worrying. In terms of the young people that we're working with, we've been pleasantly surprised as to how well they're coping and how much they've appreciated us maintaining contact, even though we can't actually do the work we would normally do. The purpose of our project is to move care leavers into education, employment and training. So the only things they can currently access are online training courses, of which there are many. But as I said, our young people, on the whole, often haven't got the equipment to access this or even Wi-Fi. So, you know, that is difficult. So at the moment, we're very much working around well-being of the care leavers, supporting the mental health and supporting the well-being, and planning for the future. We don't know what that future looks like, as no one does at the moment. But again, that will be heavily dependent on how training providers, colleges, employers react. Again, the other major concern for us is that employment outcomes are the most highly paid of all our outcomes, but we obviously do know that we're going to have high youth unemployment at the end of COVID-19. So that again is going to have a major impact on the success of the project for young people, and in investment terms as well, you know, financial return to the investors, of which actually we are one, because our organisation dipped their toe in the water with this project and became one of the investors, just on a very small scale.
That's been really helpful, Faye, to appreciate the sort of interconnectedness of your time horizons that you're trying to operate on in terms of what is happening with the delivery of services, how that is going to impact the actual evaluation or viability of delivering outcomes, and how that gets baked into a payment mechanism, which then is going to ultimately affect your ongoing financial stability as an organization.
Yeah.
And with all of that, the sort of perhaps additional stress as an organization. Graham, I see your hand up, and then Edward, I see a hand up. So I'll do Graham and then Edward, unless Edward's is just an old hand up. Over to you, Graham. Oh, and you're still muted.
That's really, really interesting. We have the same issues about youth unemployment. The skills and employment team is part of our larger team, and we're really concerned about the issue of employment for care leavers in particular, but for, you know, all sorts of vulnerable youth. And I just wonder how you think you might be able to mitigate some of those. We have a number of outcomes-based projects, one very big one that we're about to repurpose in order to, it was focusing on a different cohort, and we're moving it focus on a younger cohort. It's a £5 million, partly ESF funded project. But how do you think you might mitigate some of those outcomes for employment for youth, and the lack of employment that will be there if we're all right and going, there's going to be a large amount of youth unemployment? And what happens to delivery partners whose outcomes, as you say, are the most highly paid, are the full employment outcomes after 6 months or 12 months? I'd be really interested to hear that.
Yeah, I think there's a couple of things. One is that it ties in with asking for an extension of delivery, because what we do know is that if, you know, and obviously I'm very old, so I've lived through a couple of recessions, I know exactly what that feels like, and actually I was an employer for one of those recessions as well. So what we do know is that, yes, there will definitely be high unemployment, and young people will be more severely disadvantaged. But then the government will react to that. So some mechanisms will be put in place by the government. For instance, you know, there may be some wage subsidies that come in for vulnerable young people, which, you know, I would very really welcome, because I think, you know, money talks to employers, and there will be return to work programs, but they are not likely to come into being quickly enough for the life of this program. So we need extended delivery time to take advantage of any response the government makes to unemployment, and in particularly youth unemployment. Then then the next obvious thing really would be a change to the rate card of outcomes. Now, it's been touched upon with Department for Education, and they're not against that in theory, but everybody accepts that that is a really big task to remodel the rate card. So that's sort of in abeyance at the moment. But yeah, I think, you know, what we need is to see how the government responds to unemployment so that we can take advantage of those measures.
Thanks for that, Chloe. Edward, did you want to hop in? That's a no?
Yeah, that was the old one.
Okay.
Sorry, don't know how to get rid of it. Yeah.
No worries. I think, yeah, that's been a really helpful exchange, in particular, understanding that there's a sort of a sense of hurry up and wait in terms of making some pretty substantial project alterations. And indeed, where you've got a rate card set out, how much flexibility do you actually have to move some of those funds into alternative outcomes? Steve, are you running into similar considerations on your project in terms of what the ongoing or sort of domino effects are of right now with a sort of year from now in terms of the delivery and the payment of things?
I think it's really interesting because for us, this kind of impact has enabled some of the providers to, sorry, let me start in a different place. So there are two outcomes that are payable. One is about early diagnosis. So that's about people getting tested. That side is proving harder to maintain at current levels. And one of the reasons is that people get tested when they are attending emergency departments and they have to opt out of being tested. And if you haven't got the same footfall coming into emergency departments, then you've got a smaller pool of people who will get tested. The second way that people get tested is through GP appointments. And again, GPs are generally speaking not taking the same volume of bloods that they would have done previously. So that's a downer. The third is regarding face-to-face through some of the voluntary organisations. And as an example, one route would be that one organisation would hold kind of like pop-up clinics within bars, and people would sign up for blood testing at that point. And again, that's not happening. That's been replaced a little bit by remote testing, so at-home kits. So on the whole, that has slowed down that side. The other side is about re-engagement into care. And there are some providers who are finding that they actually have time on their hands and there is money available to them through doing clinical audit and finding out people who have dropped out according to the Public Health England records, and thereby contacting them and re-engaging them into care actually provides an income. So actually that is providing an opportunity of COVID for people to go back over their records in a way that perhaps they wouldn't have prioritised if they had other more urgent business to do. Given that they can't do it, then they're doing that. So it's kind of a mixed thing. We're looking forward into the future. COVID won't be there forever in this current condition at any rate. And we've taken the view that we, in the very helpful diagram that you produced a few weeks ago now, we're kind of still in box number one mostly, which is about keeping on with contracts. We are negotiating with other providers at the moment to bring on new contracts. And we don't need a large volume of outcomes in order to kind of break even on the project, which is helpful to us. So we've actually passed our break even point. So everything that we do now is going to be just developing more evidence about what the outcomes are. It's quite a long answer, and I hope it's relevant to other people as well.
No, thanks for that. That's really, Steve. It's really helpful, Steve. I think an interesting comparison to the experience at Sheffield Futures. Curious if anyone who's not spoken yet or sort of has been more quiet has any questions or comments or wants to jump in on anything. I see a sigh from Ian, but not an indication that he wishes to speak. Cool. So I think with that, maybe I'll pose a bit of an open-ended question to the group, which is picking up on this notion that there's some question marks around the degree to which impact bonds are doing any better than other kinds of funded services right now, or if there is some added value to things being delivered via an impact bond. And my question is really the fourth one in the agenda, which is, you know, in your experience or in your opinion, is there any learning from the experience of outcome-based contracts during COVID-19 that should be informing business as usual in terms of the commissioning of public contracts? Neil, over to you.
In my, as usual, controversial, well, not always, but sometimes controversial opinion, no, not very much. I think there have been some claims that, I've seen some claims that SIBs are particularly flexible because of the way the finance is provided, and therefore they're particularly able to adapt. I don't agree particularly. I think there's been a lot of SIB exceptionalism going on, and I think the fact is that projects have either adapted well or not so well, and I don't think that particularly the availability of investment finance creates any greater flexibility through SIBs to enable that to happen. We've seen quite a few, through the evaluation stuff, we've been aware of how quite a lot of SIB projects have been adapting, although we're not involved as a SIB provider or implementer. We are involved, as some of you know, in some grant funded programs, particularly through the Home Office, and they've adapted just as well. And of course, where some of the SIB ones have adapted, it's because, as I heard on one of these calls a few weeks ago, Mark Duggan, particularly one I know very well in North Somerset, because we helped design the North Somerset Social Impact Bond, Mark was simply saying, well, we just kind of ignored the whole SIB mechanism for a period and just focused on what was important, which as Graham's been making clear, is keeping the providers afloat. So I think the response generally has been, let's be as flexible as we can be, but I don't think SIBs have helped that necessarily. Yeah.
Graham?
I agree with Neil, but I also think one of the key issues is going to be, I think commissioners are quite flexible, and I think delivery partners are quite flexible. The real question is, how flexible are the investors of a program to shift their thinking over a period of, say, the next year, so that their outcomes are different from the ones they originally envisaged. Having worked with a fair few investors, for all the hype about investors being flexible and investors being interested in things other than basic funding, they're still really focused on the basics of the provision of funding. Whether they're flexible enough to shift is a really interesting question that if anyone has any insight into that, I'd be really interested to hear. Anybody who's had experience of a very flexible investor. But I don't know that they exist.
Anyone know of flexible investors? Ian?
Yeah, the social impact bond that I've had earlier in Scotland, it was slightly unusual in that there were 13 investors, and 11 of them lived in the local community. There were local business people who invested between 5,000 and 50,000, so they weren't institutional or quasi-institutional type investors. And they maybe did have a more flexible approach. They certainly had a more intimate maybe relationship with the service, because they could see the young people that were being serviced in the service getting the support. So I guess they were more flexible in that sense, and maybe there's potential. I mean, but if you don't have retail investors or local people investing, you don't have it, but that's just a thought for the future.
Over back to you, Graham, and then Neil, back to you.
Well, that then makes for an interesting argument that perhaps as a local authority, and as I imagine a lot of local authorities, we've been focusing on the investment provision by, you know, the standard big institutional investors. But perhaps the future social impact bonds, to be flexible, is in actually generating more community asset-based social investors. The SITR fund that is up for renewal, I believe, next year. It would be really interesting to make sure that flexible social impact bonds is in having community investors and not the big institutional investors for your project, which is really different.
Yeah, I was just going to say, no, I don't know a flexible investor in this context, because I think part of the problem is that the SIB mechanism and the way a lot of SIBs have been constructed makes it very difficult for anybody to be flexible. I do think, which is why I was nodding vigorously when Ian was introducing himself and saying there need to be easy ways to make this happen. He and I have been exchanging emails offline, because he was asking in last week's session what we could do to use social investment to help us address some of the major challenges we're going to have coming out of COVID, around particularly the need for more intervention with young people with their issues, more intervention with old people's isolation, more intervention with lots and lots and lots of things. And after I'd been a bit dismissive and said, well, the problem's so huge and the amount of social investment is so small, I'm not sure you could do that. On reflection, I think you can, but based on what we've seen as both designers of SIBs and evaluators of SIBs, it just takes an inordinately long time to get something off the ground that has such small scale that it's not really going to make it work. I think that we need to be a bit more imaginative of thinking about ways that we can use all the skills of the commissioners and others, plus the social investors, to make it happen, but do it in a less structured way. I mean, even the funds themselves, frankly, that have been set up to support this, are so bureaucratized that they make it slower, not quicker. So it's about trying to get around some of those issues. But I mean, if you do that, I'm sure there are investors out there who'd be quite happy to put their money to work in a much more flexible way.
Yeah, I definitely sense in a UK context, there's quite a lot of homogeneity in the investor realm. So you don't necessarily see a huge variety of different capital and its sort of risk appetite, the ways to blend capital in a particular project and have a capital stack with sort of senior, junior, and perhaps philanthropic money flowing in doesn't seem to be as utilized as it is in other contexts. And indeed, Ian, when you were describing the social impact bond in Scotland, you know, you do have a sort of a huge array of different investors coming together and almost investing in their local community, as opposed to it being a sort of more institutional or indeed perhaps, you know, faceless, but less strong than that. What I'd like to do is come to Ruairi next. I see his hand up, and then I'd love to hear from Faye or Steve in terms of what your own interactions have felt and been like with investors so far, and what you expect them to look like moving forward. So Ruairi first.
Thanks. This discussion reminds me that we are running a small project to explore and learn about the things that social investors do that it's not easy to describe. So it's part of the Indigo data sort of project, and we're conscious that just putting together numbers around money and aggregating those maybe doesn't unpack all the things that a social investor, at least says they do around sort of technical assistance and things beyond the money. But as a researcher, I'm interested in the association here between, or a potential association between flexibility and when the outcomes are designed to happen. Some of the SIBs that we have, the outcomes are really, really early, right? Or they're just like, you know, getting somebody into a service. And I wonder if projects that have a higher percentage of payments based on longer term outcomes gives a project more runway to sort of think and adjust. But if your financial model is based on these immediate things that are sort of more like service payments, then, you know, do you start to panic sooner than you might otherwise? It's just a question that I look forward to exploring at some point.
Yeah, I don't know if Faye or Steve, you have anything you might want to add to some of this conversation.
Well, in terms of our project, our investors are actually very supportive and quite light touch. And that's because we had a previous relationship with them, having done a SIB project with them before and been very successful. So actually, you know, sort of anything that we are proposing, they're really backing us with. So at the moment, you know, all is good in terms of the investors, and you know, they're very much you know, forwarding information to us when that may be helpful, offering to support us with, you know, our approaches to the government department. So, you know, yeah, we're having quite a good experience at the moment. It remains to be seen if that will continue as we go further down the line. And, you know, certainly from the experience of the previous project I worked on, which obviously wasn't affected by COVID, yeah, on the whole, investors tend to be great while things are going well, but when things get a little sticky, sometimes the atmosphere changes. So yeah, it remains to be seen really how this pans out. But on the whole, you know, our investors are very, very supportive. And certainly, you know, in terms of looking at changes to the rate card, as I say, if we're proposing anything, they are just backing us with that. So
thanks for that, Faye. Steve, did you want to add anything?
Yes, I mean, our experience with the investors has been very good indeed. And it may be because they're coming from the voluntary sector as opposed to the kind of private equity sector. So we've had tremendous support, and it's also, of course, we're putting our own money in as being one of the investors as well. And it will be interesting to see. I mean, you know, you're sitting around the table and everyone's got money involved. And perhaps that makes a slight change in the relationship. But I suspect it's more about private equity versus charitable sector funding.
Neil, did you want to add something?
Yeah, very quickly to agree with Steve, because I've been very interested in the structure of the EGF SIP. It has managed to achieve some of the flexibility you've been talking about having been achieved in other jurisdictions by effectively using EGF's own money as first loss finance. I'm simplifying it, it's more complicated than that, but effectively EGF underwrote the whole thing, which A, de-risked it slightly for the other investors, and B, has enabled them to attract a different type of investor. So for instance, they've got Comic Relief's Red Shed Fund involved. So there's a traditional, well, they've got a traditional SIB fund investor in BII, but also Comic Relief, a private investor, and EGF themselves. So it's a really interesting structure. Read all about it in the forthcoming report, which won't be out for a little while yet, but it's quite interesting. But it shows what can be done, and I do think it's often as I say, the whole composition of the sector in the UK has driven it down a certain path. And then the way we've devised SIBs has reinforced some of those structures and led to some things that potentially, if we want to get to scale, we'd have to address. But that's probably a conversation for another day. So.
Edward?
Yeah, I was just going to pick up on Graham's point about commissioners having a lot of flexibility. And I think in a couple of projects we've looked at, it's been the commissioners who basically got the problem permanently. So if the provider falls over, they've still got the issue. So from that incentive kind of point of view, the commissioner does have, appears to me anyway, to have quite a lot of skin in the game in terms of wanting the provision to carry on. And I think that reflects the North Somerset sort of example as well, where it's just like keep the providers alive, because actually the problem doesn't go away. The social issue, whatever's trying to be addressed, doesn't go away. So I think that's important. I know you're being slightly controversial, Neil, But I think some of the investors are probably hidebound to some extent by whatever their fund structure is and so on. But I suspect they will be looking to be as flexible as they can within some limits on that, because I think I don't detect that they're trying to be hard-nosed deliberately. And I think your point about once you have more than one interest around the table, and particularly if the provider has some skin in the game, that definitely makes a difference. And we saw that, I think, on some of the homelessness early SIBs as well. So yeah, that was my tuppence worth on that. And I have worked out how to get rid of my hand now.
Neil, did you have something?
No, just to say, I wasn't trying to say that investors have been hard-nosed through this process. I don't think they have. I'm just not convinced they've shown the degree of additional flexibility that they claim was one of the key reasons for having them involved in the first place, if you follow the slight difference. It's simply that I'm sure a lot of them have been pretty accommodating, but they've not been any more accommodating than they would have been necessarily in the normal way in the project. It's if you follow that logic, I don't think I'm not close to a number of the projects. I don't think they've been particularly hard-nosed in terms of the COVID impact specifically, which is where the conversation started. So.
Yeah, I guess, and I suppose pivoting to sort of maybe the last topic for today, what this is kind of chiming in my own mind is around the sort of, as we see projects and investors maybe adapt or flex or not to the realities of COVID-19, I actually want to draw on a question that Ian submitted prior to the event, which is around, what does this say about the opportunities to use social impact investment to create maybe new services which can contribute to a post-COVID sort of reimagining and rebuilding process? So if this is how the investment space is functioning now, what does that mean in terms of its role moving forward? And I'll wait until some brave person has a thought they'd like to share. Ian, brave person.
Well, I don't know about brave. I asked the question in the first place. So if, I just think, I think it was Faye mentioned earlier about whether government systems will react fast enough, in particular in relation to your 6-month time of delayed delivery in that particular instance. But the natural instinct, I suspect, for government in face of huge surges in demand in all sorts of areas, employment, mental health, homelessness, the list almost endless. The natural instinct is for them to throw money top down into established infrastructure that they have, and they almost try to solve new questions with old answers. And I think that would be a mistake. And as Neil referenced earlier, don't waste a good crisis. Somebody said that a crisis is what creates real change, and the change that happens will depend on the ideas that are lying around. And I think social impact investment in a broad sense, not necessarily SIBs, not necessarily the complexity of SIBs, but social impact investment as a generic model of moving money around, offers a real opportunity to do things differently. I'm not so sure there's enough people around in the senior positions who have the risk appetite to do that. We get a lot of talk about building back better, which is great, but building back better won't happen unless it's consciously done. And I think in the social impact investment, the whole field of social impact investment, we have a huge depth of experience and wisdom and the learning to bring together. And how do we bring that together to focus so that we reimagine and rebuild better, using that different way of moving money in the system, so we address new questions with new solutions and not the old ones.
Neil, did you have a hand up?
Yes, I'm afraid so. I feel like the first ERGO call I came on, I thought I couldn't get a word in. Now I'm thinking I'm not letting anybody else get in, but there weren't many people commenting, so another go. Yeah, Ian and I say we've corresponded a bit about this, and he made me think quite a bit. So what I think there's two things may happen. One is in the margins of endless data about how many people are in hospital, how many people are on a ventilator, how many people have sadly died, there's been an awful lot of attention around COVID, around the other factors that are being caused. So lockdown has accentuated that. I've seen much more said and much more awareness of how vulnerable young people can have mental health issues, how vulnerable young people are susceptible to exploitation, particularly online and those sorts of things. How we need to do something about the homelessness problem. By the way, we've effectively taken the crisis homelessness problem off the streets immediately, and we've got some fairly hefty people wandering around that space trying to do something about it. So that creates a potential opportunity if we can find the funding. And so, and I do agree with you, and there's an opportunity there. The glimmer that came out of the research we did for DCMS yesterday with Ecoris was that several stakeholders we spoke to said government is wasting too much time fiddling about with small scale SIBs that aren't addressing some of the biggest problems. If you want to get to scale, why don't you just set an agenda and say there are 4, 5, 6, 7, 8 no-brainer issues that you can really make a huge difference on. Let government set the template for those and say, here's the money, and let social investment match that. And if you did that, you could probably do that a lot more simply. You could even turn it into something closer to a true bond structure, where basically government says, we'll back it, you match fund it, and we'll give you a guaranteed return on it, because we know that, for instance, preventing care leavers going unemployed, or stepping down children from residential to foster care, which is the biggest financial one I've seen in terms of net gain, is so net beneficial that we'll guarantee you a return up front. I'm just thinking off the top of my head about issues, but I think to make a big difference, that's the sort of thing that might need to happen. So.
Does that chime with anyone else, or does anyone have a completely opposite view on sort of what this means moving forward? Social investment is not the right tool. Everyone agrees.
Just to come back here, the risk I think is, as Ian said, that the people say it's just such a big problem. We're just going to we're going to get austerity too, which I don't believe. I genuinely don't believe the government just can't afford to do that politically, or they'll just keep spaffing the money the way they have through COVID anyway. So they'll just say there's no point. But as Ian said, the problem with that is you're pushing the money through structures that we've learned a lot in the last few years through these projects, through outcomes-based commission. I sat in some fantastically stimulating discussions when I was a fellow about what's wrong with some of those mechanisms. And the danger is that people are not going to reform, that reform will not happen if we just do it that way. We'll just do it the old way. So.
Yeah, I mean, I think for sure in terms of a UK context, and every context has its sort of idiosyncratic things about it, you definitely see SIBs functioning as sort of very complex workarounds to larger sort of issues, be they around delegation of powers of units of government, the sort of split in terms of who owns particularly policy briefs, and the sort of disaggregation of the state, as it were, right? SIBs come in and they sort of create these shunts between different parts of government, which don't seem to be operating, optimally, or indeed they function as workaround rules to, budgetary processes, which are very difficult to fix. And so, yeah, is there a moment where we all can reflect in terms of how could we mitigate or ameliorate some of these systemic barriers which created the need for something like an impact bond in the first place? But I do think that that's probably a separate question from whether or not it is helpful to have a pool of capital that is willing to be invested into provider entities, especially ones that might be facing quite scarce resource realities moving into the future. And indeed, is there a way to bolster that kind of social investment market, not as a mechanism of government, but as an available pool of resources to provider entities? That's my 2 cents for whatever it's worth. Edward, and then Rory.
just picking up on that, your last point, David. I think where some imagination might be forthcoming is in effect in the VCSE sector. You can't put equity in, if you like, but you could put quasi-equity in to help some of them through, which is in effect social lending to some, with the outcomes stroke the long-term payback being linked to some of the future delivery. So in effect, as long as you can help that organization survive through the dip, you have a repayment schedule that's linked to some excess performance, if you like, as long as they come out the other side, and which would then potentially link to have a government chooses to contract for outcomes, whether at a local level or nationally. But it's some imagination around. I mean, it links to the idea that the Treasury have been talking about turning some of their COVID response loans into equity stakes. So in effect, using that as a way of putting equity, so that at least there's some payback for government for some of the money it's put out the door. So I think there's some potential mileage there. It's not linked directly to SIBs, but it's talking about how social investment might be applied.
Thanks for that, Edward. Ruairi.
Just a comment that whatever the learning is here, I think it may also be relevant to some of the UN Sustainable Development Goals, and may be relevant to what may be an ongoing emergency around climate change. And there are a lot of vulnerable populations are disproportionately affected by climate change emergencies, and I think that we have an opportunity and a responsibility to share what we're learning here more broadly. Just a thought.
Thanks for that, Ruairi. I'll invite any sort of final thoughts from anybody if they want to leave us with a nugget or indeed a reflection on some of the conversation thus far. Ian?
It was just picking up on what Ruairi just said. You said that we have a responsibility to share that learning more widely, Ruairi. Any thoughts about how to do that, how that would work?
Yeah, I think being deliberate around this, the knowledge sharing between different groups here is important, and capturing stories. I did some work with NASA a while ago on around knowledge sharing about a different topic. One of the things we learned there that it's not about sort of building some IT system. It is more about sort of people telling the stories of what's sort of working. And obviously we're a research group, and so the social science research is important in communicating in that way. But I really do think that sharing sort of first-person narrative stories and about this in a very deliberate way is a good way of sharing knowledge. And I know that the Go Lab's work is expanding to look more at international development in these, and this model being potentially used in many more places. And I think that it's important to bring the practitioner stories around the challenges in particular, and not, so that it's not just about, glossy success stories or talking about what, all the different wonderful things investors can do, but have practitioner stories about what happened in a challenge. I think it's important to bring those in a deliberate and structured way to more broadly to a wider community.
Anyone else? No hands. Well, thank you for what I thought was a really interesting conversation. What sort of stood out in my mind was, again, sort of the interdependencies of a lot of the topics that we speak about as a group, really highlighting, as Faye suggested, this sort of, alterations now affecting evaluation findings and payments later, and the sort of knock-on effects of as Graham was mentioning, the solvency of the delivery and the provider market more generally, and indeed looking to perhaps the future of social investment, rethinking how quite cumbersome development processes could be mitigated or changed to either make it easier or quicker to set up an impact fund, or indeed inform larger systemic shifts. So I think with that, we will wrap for today. But again, thank you so much for joining. We'll have details out soon about next couple of sessions, but if you have an opinion and you want to tell us about that opinion, you can shoot us an email about what you might like to discuss come July, August time. Yeah, we'll circulate, as we always do, sort of follow-up notes and post recordings from previous sessions. I suppose just one note to that related, all of the recordings of previous sessions are online, and I think a lot of the topics that we discuss come up in different ways as we gather, and so you'll see question marks about transparency and accountability in recovery efforts, which got brought up today. We've got a session specific to evaluation, so have a look and see if there might be something in that for you. Also related, we just had a piece published about COVID-19 in lower and middle income countries that Tanya put together, a colleague of ours. So that is up and published, and you can see sort of what some of the conversation around that has been distilled into. So as always, thanks for joining. I hope the rest of your day is enjoyable, and we'll see you soon.